believe it or not, all my research started right here in this studio 11 years ago. And in a few weeks, September 18th, I and 2 other investigators are going to be speaking in a symposium dedicated exclusively to the treatment of depression with Botox. And this whole concept started right here in my studio in 2003. And I'm excited about this because this has been a long time in the making. When we first published our studies, although there was a lot of press, there were also a lot of people who thought it was nonsense too. So it's really nice to see that our work has been replicated. The gold standard in science is replication. It's been replicated by Dr. Wollmer and his team of associates in Germany, and Dr. Magid and her team in Texas. And our 3 groups are all going to be speaking together, all talking about clinical trials, randomized controlled trials, all showing the same thing, that one treatment of Botox right here has a profound effect on improving depression in a lot of people who are really suffering. Now, more than 350 million people around the world are currently suffering from depression. And this is a very serious disease. And although we have treatments already, at least a third of everyone suffering from depression doesn't really benefit from the existing treatments. And I know that personally because my mother was one of them, and she suffered from depression, and she tried everything, and it just didn't help. And so for me, the concept of us really bringing forth to the psychiatry world and to the greater world that we have a potentially new treatment that has relatively few side effects, it's easy to do, that's really exciting. So, and it's taken this long to bring it here, 11 years, and we're very pleased that some of the major media, like the Today Show, New York Times, Washington Post, are picking up on this and writing about it in a way that is not dismissive just because it has the word Botox. Because Botox is just a drug, just like any other drug, and it doesn't know what it's supposed to do. And it just so happens that we can use it for this new use, and that's our goal.